It's indeed very happy event to celebrate World Hygiene Day today, and happy Doctors Day to all of you. So we know that laughter and hygiene. At the end of the day, when you go to bed, the thing you remember the whole day is that how many times you laughed in this today, and how much happy you are at the end of the day. So that the satisfaction or the amount of fullness the laughter gives to you is very important. So for the next 5 minutes, I'll be talking about hygiene. As today's topic is about hygiene, in order to have hygiene, it is like physical hygiene and psychological hygiene. In the psychological hygiene part, the laughter or the humor takes place. A enormous amount of uh, happiness or psychological well-being is maintained by the laughter and humor part. And the word euthymia is that a state of positive mental and psychological well-being which is needed to be happy. So everybody works, everybody does their work, everybody earns money, everybody practices, everybody has their own family, but how much mentally, how much happiness you are at the end of the day carries a much. So nowadays we are in a world of so much of stress, so much of sorrow, so much of all the difficulties which we are facing. But how to come out of it, how much positive mental health or psychological well-being you are having is at most important. This concept also is important in routine clinical practice, improve the quality of life and coping skills in patients with type 2 diabetic patients. We know that type 2 diabetes mellitus patients, how much stress they are having. So yesterday I had a 22-year-old male patient who was obese with BMI of 28 with high blood sugars, and I was literally weeping in front of me. Doctor, I am just 22 and I want to continue my drugs till I die. So I don't have an answer. I don't have what you say. I can't console his sorrow within 5 to 10 minutes time which I am spending with him. So that means that how much of euthymia is needed in our lives is very important. And the glycemic happiness should be there to all the type 2 diabetic patients who are enter your OPD. Mainly, you should be always smiling in front of your type 2 diabetic patient. You never talk any negatives, or you never talk about any negatives of their type 2 diabetes. You never say to them that you will get this disease, you will get that complication, you will get that, and they don't know about all the intricacies of the complications, and they'll be remembering only the danger parts or danger things which you tend to tell to them. And the communication is very important, which gives happiness to them, and then they get into state of mental well-being, and then that in turn leads to euglycemia. This euthymia model is publication by Sanjay Kalla sir, which is very, very important in our OPDs, and humor plays a enormous role in this euthymia. And we know that laughter, humor, or gelatology takes care of diabetes also. It upregulates NK cells, modulate ROS, influences vascular tone, decreases postprandial blood sugar, decreases catecholamines, cortisol, or the counter-regulatory hormones opposite to insulin, and lower CV mortality. So what not a lighter note of humor or laughter to the patient will give it to you. And nowadays we are having so many yoga days, so many laughter yoga therapy, humor clubs. Sir, our senior sir from Guntur, Dr. Ram Kumar sir is famous for his laughter club, laughing club. In for last 5 years, he is conducting with all the doctors in Guntur. And at the end of my speak, I would like to conclude that laughter is very important in everybody's life, and you should tend to make your patients also smile, laugh, and you have to pull them from their sorrowness, or you have to pull them from their misery, so that we make their lives happy. Thank you so much, sir.